Let's talk about how to interpret your urinalysis results. So you did the urine test with your doctor, urinalysis, maybe waiting for culture, you got your first results back and you see a lot of flagged items and you're about to text, message or call your doctor to ask what are all those flagged items means. Wait, let's go over a regular urinalysis and talk about every item so you might find the answers without needing to message your doctor. So the first item that you see on your urinalysis is color. And it could be yellow, it could be amber, it could be red. The normal urine color is yellow. It all depends of what mixing into your urine. So let's say if there is some blood, the color might be anywhere between amber to very red. Another reason to have a different color of your urine, for example, bright yellow, is when you take a supplements of, for example, vitamins group B, they will turn urine neon yellow, or azo can turn it orange. The next item is clarity. Urine should be clear, however, the clarity can depend on what you eat or if you have infection. For example, eating a lot of protein can make your urine cloudy, or having a urinary tract infection can also make the urine cloudy because of the protein of the bacteria in the urine. The next item is a specific gravity. It basically means how concentrated your urine is. The higher the number, the more concentrated urine is. So you're probably a little dehydrated and you should drink a little bit more fluid. Or if the number is low, you can cut back on the fluid. Urinary pH. If pH low, it will be acidic. If pH is high, it will be alkalinic. The pH of the urine will depend on what you eat or if you have infection. For example, the foods that will make a urine more acidic, meaning pH will be low, are meat, cheese, some carbonated beverage, or some very acidic food, for example, cranberries or juices. And some of the foods will make urine more alkaline, meaning pH will be higher, some vegetables like kale, broccoli, chickpeas or lentils, and also mineral water. Glucose. Again, normally we should not be spilling glucose in our urine unless there is a diabetes or there is an issue with the kidneys, or some people who have a diabetes, they take a medication that make you excrete extra glucose through your urine. So if you have a glucose in your urine and you haven't been diagnosed with diabetes, that's definitely something to follow up on with your doctor. Bilirubin. If you see bilirubin in your urine, there is probably some hemolysis or breaking down of the red blood cells happening somewhere in the body. And it could happen for different reasons. You do need to assess the clinical picture. Hemolysis can be seen in the body due to the strenuous activities, after immune conditions, so sickle cell disease. Ketones. Normally, we don't have ketones in our urine unless there is not enough glucose in your body to satisfy your energy requirements. You probably heard about ketone-based diet when you don't eat enough carbs, so your body doesn't get enough glucose to burn, so body starts burning the ketones. People who are fasting or people who can't keep anything down, like throwing up, having diarrhea, you can start noticing ketones in your urine. Blood. And this is the most common concern that I hear as a urogynecologist. So this particular item, blood, doesn't really reflect the amount of the red blood cells in your urine. And the reason why this is not specific, because it can detect any elements such as myoglobin, hemoglobin that can be elevated just if you work out too hard. So if you see that positive, you need to look at the RBC. And speaking of red blood cells, RBCs, there are certain criteria that should be triggering evaluation for your kidneys, ureters, and bladder. And depending on your risk factors, the evaluation will be different. Make sure to watch my video on hematuria, where I discuss all the possible causes and what needs to be done if you have a blood in your urine. Protein in your urine. Normally, you should not have protein in your urine unless there is some issues in the kidneys, or you eat more protein, or there is infection, or for women who are pregnant, for example, if they have a preeclampsia, eclampsia. So if you have a protein in your urine, make sure to follow up with your doctor for possible underlying condition. Nitrite. Normally, we don't have nitrites in the urine. If we do, we're going to have a high suspicion that you have a urinary tract infection. Or if you take pyridium or azo, it will make positive nitrites in your urine. Leukocytes. Normally you don't have leukocytes in your urine. If you do, it could be a sign of infection, but you do need to have a confirmatory test done, for example, urinary culture and sensitivity, or they could be present due to contamination, for example, from the vaginal discharge. Squamous cells. It's actually a good indicator of how clean your clean catch actually is. When it's positive, it doesn't mean that there is any dangerous condition going on. It's just a sign for us to know that there was some contamination. Because squamous cells, it's the cells from the vaginal discharge surrounding skin. And in the case when it's positive, we should wait for the confirmatory test with urinary culture and sensitivity to determine if there is any clinical significance for the squamous cells. And if you would like to have some tips on how to properly collect your urine, depending on the test that you're doing, make sure to watch my prior videos on the urine tests. And of course, bacteria. Most likely it's due to the urinary tract infection. However, some bacteria from the vaginal discharge can get in and it can turn the urine positive for bacteria. Make sure to wait for the urinary culture and sensitivity to confirm the type of the bacteria. So when you see the results of your urinalysis and you see a few flagged items, first of all, do not panic. Flagged items doesn't always mean something is wrong in your body. There are a lot of different reasons why some of the items can be flagged and can be abnormal. It's very important to interpret urinalysis as a big picture. You need to take in consideration any additional symptoms, or if you have a period, or if you need medication you're taking, to determine if there is any signs of infection, any signs of any damage for the kidney, and advise you appropriately and treat you if needed.